Good afternoon. Wednesday, July 8th, 2020. First, I'd like to report on the COVID-19 numbers for the state of Kansas. Today, we have 17,618 positive results, which is an increase in 717 cases since Monday. 190,864 negatives and 282 deaths recorded, an increase in 2 since on Monday. A couple of things on data highlights. Today, we began including the percentage of cases that are symptomatic and also those that are asymptomatic, and that can be found on our COVID-19 microsite on our KDHE webpage. It's at KDH/coronavirus. As of today, 60% are listed as symptomatic, with 9% asymptomatic and 31% with information not available. When people draw or gather the sample is when they record on the request. If they're symptomatic or asymptomatic, we're working hard with the caregivers and other people who do the sampling to fill in that blank, but that's the current rate we have, and that's on our website. Point of clarification, it's come up by way of a question before. Our case numbers are based on the number of individuals, people, not on the number of tests. So if a person has multiple positive test results, they're only counted one time in our case counts. So there's no double counting, in other words. Clusters, which you see depicted here on my left, your right. As of Wednesday, July 8th, we have 250 clusters, 120 of which are active. The 120 active clusters are currently associated with 4,291 cases, 185 hospitalizations, and 59 deaths. The number of clusters associated with gatherings and daycare schools is increasing. Currently, we have 23 active clusters associated with gatherings of various types and 6 active clusters in daycares and schools. Clusters associated with gatherings have increased by 7 since Monday, and those include exposures at bars, parties, family get-togethers, and church services, among others. Tests. Testing in Kansas continues to increase. In the month of April, labs across the state conducted, so again, back in April, the labs across the state conducted 26,000 tests. By comparison, in the month of June, that number was increased over threefold to 79,000. The Kansas Health and Environment Laboratories, which is a state lab, is one of more than 50 labs performing tests in the state of Kansas. In April, the KHEL, the Kansas Health and Environment Laboratories, performed about 4,500 tests. In June, that number had increased to 13,200. We understand that the increased amount of testing throughout the state may be impacting the reference lab's ability to turn around samples in a timely manner. We've been hearing about longer wait times for test results in the commercial labs. We encourage individuals waiting for test results to continue following the directions of their healthcare providers. Our state lab turnaround continues to be about 24 hours after receipt of the sample at the state lab. I wanted to give a little bit of a science lesson for the day. And part of the reason is because there is a very important paper that came out today in Nature, and the publication Nature. I was fortunate to get a pre-publication copy of it, but it was just released today, June 8th, 2020. It's a Sentinel article, really, and it's called "The Effect of Large-Scale Anti-Contagion Policies on the COVID-19 Pandemic." So what I mean by that is, what the title means is large-scale anti-contagion policies are the things that we've done so much with, about mask wearing, about social distancing, about school closures, business closures, et cetera, stay-at-home orders. So the question is, and you'll recall, COVID-19 is still a very new virus, and the research on this has been lagging behind just because it's so new and it takes a while to go through these processes. So this is a good publication, Nature, and very credible science. This study of the effectiveness of these anti-contagion policies span many countries. One of the things it showed that unabated, the COVID-19 infections grow at roughly a rate of 38% per day. Remember, way back in March even, we talked about the Nike swoosh, the exponential growth curve, and it takes off slowly and then goes very steeply. And that's really what they're getting at, confirming that left unabated, 38% per day of growth of new cases is an exponential, spectacularly large growth, and it's exactly what we've seen. Anti-contagion policies significantly and substantially slowed this growth. They looked at 6 different countries, primarily, by the way, United States being one of them. Across those 6 countries, these interventions prevented or delayed approximately 62 million confirmed cases, corresponding to averting roughly, when you think about contacts and more contacts, roughly 530 million total infections worldwide. So that gives you an idea of the rapidity of growth left unabated. Studies didn't specifically study masks, but there's a lot of information coming out about masks. So part 2 of science lesson is about masks. There's a recent article in Health Affairs that, and I'll quote it, the conclusion, quote, "A natural experiment of state mandates," in other words, comparing one state to another, "a natural experiment of state mandates in the United States showed a drop between 1% and 2% per day." So if you think about that, 1 to 2% drop in the infectious nature of the virus every day after 30 days is 30% to 60% the next day. And so the benefit just keeps adding on as well. Importantly, 9-fold decrease in COVID-19 per capita mortality rate in countries with cultural norms or government policies that support public mask wearing. And I think these 2 studies get right at the heart of the issue, is that do masks work? And the answer is becoming more and more. And I've got right in here one article alone that is a summary of 172 different articles on this. And I think this question, and this is what I'm becoming more and more comfortable with all the time, is to saying this question has been asked and answered. Masks work. So the bottom line, we are seeing a significant increase in cases. And due to the things that we've talked about, that the return to normal has people gathering much more and doing things that would not necessarily be in keeping with the things that I just talked about in terms of containing it. So now more than ever, it is essential for you to take precautions to mitigate the spread of COVID-19. You are your own preparedness. It's time to get back to the basic. Practice social distancing, wear a mask in public, practice good hand hygiene, stay at home when you're sick. And by the way, I've said this a million times, stay at home when you're sick. People are still going to work when they're sick. Because a lot of these active cases where they've come from, it's people that said, yeah, I wasn't feeling good, I did have a low-grade fever, but I went to work anyway. It really amazes me that people are still going to work sick, knowing that they really shouldn't. And finally, avoid gatherings or groups where these are. So that's the end of my prepared comments.
Secretary, I wonder if, and this is your opinion, we're still technically in phase 3 of those recommendations.
Yes.
Should we be giving counties new recommendations? And, of course, it's still up to them, but should we be saying, hey, go back to gathering sizes of no more than 15 or 20? Do you think that's something?
That would be very sound public health guidance. I think we're becoming more and more appreciative of the fact that gatherings are where the virus is mostly transmitted. So smaller gatherings would be very beneficial for slowing this down, and that would be sound advice. But that would be advice given in somewhat of an isolation from business, for example, and we really understand the imperative to keep our businesses open, and I think that we can still, even with where we are now in phase 3 with that size, do like you are doing here with wearing masks, socially distancing at work, and don't hang around a lot of other people in the work setting without having those protective measures. I did as I do every now and again, I videotape questions from kids today, and they're always fun questions. And this one girl, Maisie, asked about, what if we just go to a store and kind of hang around? Are we going to, run into an asymptomatic or a symptomatic person? Or are we going to get it? And I said, well, first off, Maisie, you shouldn't hang around in stores where there's going to be people coming and going. So, but if you do, and she's old enough, wear a mask and don't congregate. So I think, in answer to the question, do we need to backtrack? It would make sound public health advised to do that, but I don't think it would be necessary if people would do all those other things like they talked about in the anti-contagion.
Secretary,
Sure.
we're only a few weeks away from the start of the traditional school year, and I'm curious if you've been in discussions with KSD districts about, I guess, safety protocols for reopening school buildings, and if you can at least give us a high-level overview of what maybe the keys to coronavirus safety are going to be in our school buildings.
Right. They are coming out, the Department of Education, with their many subgroups that they've had working on this to provide guidance to along with the superintendents to the school boards, have not come out with their final recommendations. But it's the things that I'm quite certain that whatever the local school boards will choose to adopt will not be business as usual, and will include things that are the fundamentals, again, embodying the fundamentals about changes in schedules, spacing, a mixture of in classroom and not classroom. I think rather than preempt what the Department of Education says, I think we'll be seeing those within a very short period of time.
Secretary,
Yes.
can you talk about the percentage of tests returning positive? You talked about the increase in testing overall. Are we seeing the percentage of tests returning positive remain steady, or is that going up or down?
Right. Good question, and I'll repeat that. The percentage of positive tests, what's going on with that? Is it going up, down, or staying flat? And are we seeing more, and I'm interpreting it also to mean, are we seeing more positive test results because we're doing more testing overall? And it's a good question. The answer is the percentage positive are going up all the time. It's not unusual here the last few days to see 10, 11, 12, 13% of the tests. And when we look back in April, we'll say that it was very common to have runs of 2, 3, 4% positive. So it is an ominous trend to be doing more testing with a higher incidence of positive tests. That means that without question, and that Nike swoosh that I've talked about with the exponential growth phase, that we are still very much on the growth phase. That's why we have to contain this. And you might note that New York, that's one of the things that they use for putting states on their travel restriction list. And they have, and I use this as kind of my own personal metric, that anything above 10% is problematic. And that's, the lower the better, obviously, but New York uses 10% of test positive.
Is there any possibility that what's contributing to that rate increasing is because we are capturing more asymptomatic cases than we have in the past? Because of population testing and that?
I think a good question is, it because we're testing more is asymptomatics. The old thought was that the more asymptomatics you had, or I should say the more people you have that don't have any symptoms, if you test those people, that it would drive the number down because they're not infected. But what this is telling is that it doesn't make much difference, especially in a younger group. If they're asymptomatic or symptomatic, they're quite likely to be positive. So it'll take a while to unfold the real answer to that, but I think it shows that just there's a growth in case volumes. And the rate of the growth, it's not just about the numbers of cases, it's about the rate of growth of the cases over time is going, so both are up. Martin?
Can you track the numbers of counties that have fought into the governor's mask rule and those that haven't?
That is being tracked. I just got those numbers this afternoon, and most of the counties are not having a mask mandate.
Are not having?
Yeah.
Are not enforcing the governor's?
Right, exactly.
Most aren't.
Right.
Have you seen any shortages of testing supplies in Kansas recently, like in other states like Louisiana, Arizona, and Texas?
So the question is, are we having a shortage of testing supplies? The answer is no, not in Kansas.
And just one more thing. I think on Monday you said that we're beating some kind of 2-week record. I just want to clarify. We mean that again today.
When you're talking about the 2-week record from today versus 2 Wednesdays ago till now,
Yeah, like a 2-week spike.
yeah, we're right at 700-800 every couple days, and that last week period of time was in the thousands, so it is continuing to go up. I haven't added up the exact time period you're asking, but it has not slowed down.
Secretary, August is around the corner, they're talking about schools or whatever. Some of them are talking about delaying it till October. Do we know in October, is there gonna be another spike, only 50% of the kids going?
Yeah.
What do you, I mean, there's a lot of unanswered questions. What can you tell them in your opinion that you think is the best? Should the person wait till October to start school?
At the current rate, there's nothing reassuring about October. You know, the theory was based on the early modeling before we had great statewide data, was it was going to go down like I showed you last week, I think, on that graph. But there's nothing reassuring to think that October will be any better than what we are now. I have one thing I want to point out, by the way. Did you notice corrections? Number of outbreaks now, 0. Number of cases, 0. Number of hospitalizations, 0. And number of deaths, 0, in terms of active outbreaks going on right now. Now, that's just one line on that graph, but it tells a monumental story of success. And remember all along we've been talking about how are you successful when you have a case and then an outbreak or a cluster. And we've talked about, 1, testing people as quickly as possible, quickest turnaround as you can, isolate and quarantine, contact trace, test the staff, and in this case staff and offenders, drive it into submission, the virus, and then go back and retest. So when we did that at a number of different sites, went and retested and still had positive cases, but a very small number by comparison, repeated again with isolation, quarantine, and then retesting. And that's exactly how we want to respond to every cluster that we have. Martin?
Let me just get clear. You said the majority of the counties currently are not following the governor's
Yes.
draft rule.
Yeah.
And that means they've taken some sort of, not necessarily positive action, but they've taken some sort of action.
Yes.
Because
Yeah.
if they do nothing, the rule is effective in their county.
Most of the counties that don't have a mask mandate have taken action to not make it required, but even, I saw one county talk about it being aggressively recommended.
And so when we look at that mask mandate, even some cities now, while the counties have said no, the cities are saying yes. When should people, if we do see that impact our numbers, hopefully in them lowering, when will we be seeing that impact? How long will that take to catch up?
Yeah, question is, and if I may paraphrase, with the kind of confusing patchwork quilt of where are you required to wear a mask and where are you not, when would you expect to see benefit if people were adherent to mask mandates such as were articulated in the governor's mask mandate? And the answer is you don't see it right away, but if people really do that, and remember the study I talked about, the anti-contagion, when you add in, because masks won't take everything away, social distancing won't take everything away, hand washing, surfaces, all those things, none of those take everything away 100%. But with the mask wearing, you would expect in 2 incubation periods to have, as long as they're doing a modicum of the other things we talk about, in 2 incubation periods, so 28 days, you would expect to see it drop off dramatically.
Do we have, and this may be more of a question for the hospital association, do we have any way of measuring whether our medical providers or hospitals are getting more effective in treating people with COVID? Whether that's pushing down the average time of hospitalization or pushing down the number of people that go on ventilators. I don't know if we have any way of measuring whether our medical treatment is becoming
Yeah. Well, I don't have the question was about how are we doing in hospitals? And I can tell you some things. For example, we have fewer patients hospitalized per capita than other states. We have fewer hospitalized patients dying per capita compared to other states. We do not have a shortage of ventilators. We do not have a shortage of hospital or intensive care unit beds. We have every patient that it qualifies and needs to be treated with remdesivir, they're being treated with that. Have we aggregated and have the researchers aggregated the data looking at all the various variables that plug in? We do not have those data yet. And it's going to take a fairly good size sample size. Unfortunately, we're getting to be a fairly good size sample size. But you know what? What I will commit to doing is finding those out. Matter of fact, I have a hospital call every other week, and then I have one with critical care doctors every other week. And I think that would be really interesting to report on, so I'll find
It's
out.
going to be relevant if we are going to see a surge, it'd be kind of relevant information.
Yeah, very much so. And we are not strained at all yet. That doesn't mean that we don't consider every hospital ventilated death patient to be sad, unfortunate, and loss, but we're doing very well here on the hospital side in the state of Kansas.
And going off of hospitals, county health departments too, what is your communication with them been like?
With-
Are they, and especially looking at contact tracing, are they being overwhelmed with contact tracing? Are they
Really good question. And it was with the local health department?
Local health department?
Yeah. Question was, how are the local health departments doing, and are they overwhelmed? And the answer to that is some places that is true. There are some counties that have not had the sufficient staff. That's why we've been augmenting their staff. And we've had this conversation before with, we've trained a lot of volunteer contact tracers, and we brought more in-house as employed persons as well. And as the world of business goes back more towards normal, as people go back to college, some of those volunteer contact tracers will peel off and not be available to us. So we're looking at an outside firm that will help us essentially to outsource some of the contact tracing should we get pinched. We have deployed volunteer contract tracers to certain counties that either are a small county that have very small public health staff, or to middle or larger size counties that are just overrun by sheer numbers. So, but we're in really good shape for now.
Secretary, how long do you think we'll be wearing masks? Do you think it'll be for the foreseeable future?
Yes. How long, let me rephrase the question, or repeat the, how long will we be wearing masks? And I think it will be for the foreseeable future, until which time we bend that curve and bring it back down. And I know what you're going to ask me next, and that is, when is that bend of the curve going to be? It's a little bit like what your neighbor to the left there asked. And I think that we could bend the curve significantly if people would adhere to the guidelines. And again, as per the other question, in a couple incubation periods, we should be able to turn this down. But it can't be, that won't happen with the rate of people going in mass gatherings, or sufficient, or larger gatherings, and not doing the things that they need to do. That is one of the secret sauces to turning the corner on this.
Secretary, with talking with the scientists, how close are we to a workable vaccine?
There are, every now and again we get glimmers of hope, and there are vaccines that are being put into people's bodies now that are doing phase 1 testing. You'll recall that phase 1 testing is safety, to make sure that they're safe, because nothing goes any further into effectiveness testing until we know they're safe. And we have, and there's even, you may have even read it in the press, there's a population being tested in Kansas City on this, which is a DNA type test, vaccine, excuse me. And so I think we're pretty close to getting them into the experimental phases. It'll be interesting and important to see how quickly or slow we can move through that. But there's some glimmers of hope there.
In Kansas City, is that like a building that you have all these people in that you make special for it, or how does that type of testing, if you could go into it a little deeper?
Yeah, I'm not an expert on the methodology that's used, but it's a pharmaceutical company that uses these. It's not a live virus, so there's no risk of transmitting. It's some of the viral genetic material fragments that are thought to be the ones that will drive an antibody against it. They're just free-living humans that signed up. And curiously, there's been no shortage of people. And I think this is a testimony to, one, people want to become immune, and secondly, to the spirit of cooperation for one's fellow man. They're signing up to do this. They have more volunteers than what they can handle.
One question from Martin.
Do you think mask use would be different? More mask use, have the medical industry said wearing a mask prevents you from catching COVID-19 rather than spreading COVID?
Yeah.
Is anyone looking at that to see if you just had the wrong sales?
Yeah. What Martin asked was masks use. Do we sell it better if we say you'll protect yourself than you'll protect others? And I think that, well, first off, you do protect yourself, and masks do protect you. They're not purely to protect your fellow man, but they do both very well. And I think what's something to watch for, and I'm going to leave this, finish on this note, is that I think one of the things that we're going to watch for very carefully is, and to your question, the masks protect from droplets, the microscopic droplets in the air. The question is whether the viral particles themselves can aerosolize, because that would make, that's a little bit of a game changer, and the pure science on that is not really available, but that would then change us to wonder about air handling systems and other ways of looking at ways to remediate this. So just stay tuned for that one. We'll talk about it sometime. Thank you.
Thank you very much.
Thanks. Oops.
Like I was saying, like if you get the number of cases 2 weeks ago.
I'm sorry, say it again.
Get the number of cases 2 weeks ago, and you take